Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rap, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, now I'm looking for.
What's going on? What's going on? Good evening and welcome to another broadcast of Steve the Kidney Nurse. I am your host, Steve Belcher. Thank you guys for joining me this evening. Tonight, we got a great educational moment topic that I think is really important that is missed and not talked about with kidney warriors, especially with kidney warriors. You know, this issue, anemia, affects many people with chronic diseases. It affects people with sickle cell, cancer, lupus, and of course, diabetes. Excuse me. Okay, and of course, kidney disease. So tonight's topic, anemia and chronic kidney disease. You may have kidney disease stage 4 or be going into stage 5 and dealing with anemia and not even know it. Hell, you may even have stage 3 and be dealing with anemia and not even know it. And you're like, Steve, wait a minute, ho. What is anemia? I heard about it. You got people who say, I'm anemic. Haven't even been diagnosed. Just because they may feel cold a little bit, they're walking around most of their life. The doctor never told them they had anemia. You got people saying, I'm anemic. Okay? Quit that. All right? If you haven't been diagnosed and experienced any of the symptoms, then you're not anemic until you've been actually diagnosed with that. They say, Steve, what is anemia? You keep throwing that word out there, anemia. What is it? I'm glad you asked. So, well, first, before I say what's anemia, let's just say this. Hemoglobin or hematocrit, they measure your blood count. All right. So, a hemoglobin, a healthy male, is 13.5 to 17.2. And females is 12.1, excuse me, I'm sorry, 12.6 to 15.1 per deciliter. Like, what does all that mean? This actually measure the hema or the blood and hematocrit, the count, your blood count. So anemia is a condition, okay? Is a condition in which your blood has a lower than normal amount of red blood cells or hemoglobin. Okay, let me repeat that. Anemia is a condition in which your blood has a lower than normal amount of red blood cells or hemoglobin. We all know what red blood cells are. But hemoglobin is the iron-rich protein that allows red blood cells to carry oxygen from your lungs to the rest of your body. Let me repeat that. Hemoglobin is the iron-rich protein that allows red blood cells to carry oxygen from your lungs to the rest of your body. With fewer red blood cells or less hemoglobin, listen up, your tissues and organs, such as your heart and brain, may not get enough oxygen to work properly. Okay, so if you're a kidney warrior, or you got sickle cell or lupus or any disease, cancer, just got hit with it and they kicking out the word anemia and you've been having some symptoms, which I want to get to, this is what anemia is. So for the kidney warriors, you may say, Steve, how is anemia related to chronic kidney disease? How is anemia? I got kidney disease. They got kidney disease. How is anemia tied into it? So listen, anemia is a common complication of chronic kidney disease, or CKD. CKD means kidneys are damaged, okay, and can't filter blood the way they should. So if you got chronic kidney disease, 1, 2, 3, 4, even 5, which is the end stage, your kidneys are damaged. And so they can't filter the blood the proper way like they used to. This damage can cause waste and fluids to build up in your body. And CKD can also cause other health problems that you got to be on the lookout for. So what happens, Steve, with kidney disease? So when your kidneys are damaged, one of the things that your kidneys do is secrete a hormone called erythropoietin. So what this hormone does, erythropoietin, it stimulates the bone marrow so it can reproduce more red blood cells. Now, when your kidneys are damaged, it may not secrete that hormone as much or not secrete it at all. And so what they do is they give it to you synthetically, right? They may give you something called Airnest. That's what I'm holding here. You can't really see it on the screen because of the green screen. But you may get Airnest. You may get something called Macera. Or they may treat you with something called Epogen, derived from erythropoietin, Epogen. So you get these shots, and what it's designed to do is help your bone marrow or signal it to produce more red blood cells. Okay. However, anemia is less common in early kidney disease. Like I got kidney disease stage 2, and I don't have anemia. You may have stage 3 and not deal with anemia. Stage 1. So anemia is less common in early kidney disease, and it often gets worse. It often gets worse, guys, as kidney disease progresses and more kidney function is lost. What's going on? What's going on? Welcome to the broadcast. Thank you for joining. The topic tonight, anemia and chronic kidney disease. What you should know. And if you're dealing with any other chronic illness that impact you, far as anemia from that, this show is for you as well. So you can get, if you don't already know and done your own research, at least you can get an idea from here and what you're dealing with, and you can move on from there. So does anemia and CKD have another name? Is there another name for that? Well, anemia and CKD is also called anemia of renal disease. Renal meaning kidney, the renal system. Okay. Now, how common is anemia in CKD? You may want to know, do you got anemia? And you may be dealing with CKD right now, which is chronic kidney disease stage 2 or 3. You may be scratching your head. Do I got anemia? Did I look at my blood work? Did the doctor, you may be trying to think back if the doctor said anything about anemia. See, this is something that you should keep abreast on if you're dealing with chronic kidney disease, whatever stage. Because if you losing blood, and don't know it, in one way, what's common is kidney patients have GI problems or called GI bleed, and They bleed from the stools. It's in the stomach. So you may not even know. It's not going to come out bright red. Sometimes it may, but a lot of times when it's in the GI tract, the bleeding, it rears its ugly head through the stools. That's why they say, oh, is your stools dark and tarry? Is your bowel movement dark and tarry? That's one indication that will let you know you have a GI bleed. Or they may give you these cards, these GUAC cards. And what you do, they tell you get the card and they give you a wooden stick. They tell you after you have a bowel movement, get a piece of your stool sample. You're like, ooh, what? I gotta take a piece of doo-doo up and put it in the card? Yes, because what they do, you do that, you smear it on the card, put it in the plastic. We bring it. I used to hate to have to do that. Be at work, had the mask on, you know, it had the gloves on and the mask. Patient come with the sample, and you got the little bottle over there, putting it on, testing it to see if it's blood in the stool. Right? Why you want to keep abreast of this? Because you don't want to be getting a transfusion. I mean, yes, if you need one, but if you have to get a transfusion and you don't address that issue of what's causing the bleed so you can stop it, so it don't get low where you got to get a transfusion now, and you may not even notice at the time because you going through these issues. Now you're getting a transfusion, 2 pints of blood. Now you're getting antibodies. Now you're getting other antibodies in your system. And then when, you know, you get on dialysis and everybody tell you, go get a transplant, and you finally sign up and you go testing, and they come back and tell you, you got a high PRA rate. It's going to be hard to match you. Did you get transfusions before? And you like, yeah, that's what my doctor said I needed, a transfusion. Well, we got to do something to get this PRA count down, because we may not be able to find you a kidney right away because of that high PRA count. And you saying to yourself, God damn. Like, how did this happen? So how common is anemia in chronic kidney disease? How common is this? Anemia is common in people with CKD, especially among people with more advanced kidney disease. When I say advanced, meaning stage 4, stage 5, and after, even on dialysis. Hell, you may be even watching this even now or after the replay and remember a time when you were in the hospital for GI bleed. This is very common. More than 37 million American adults. More than 37 million adults may have chronic kidney disease, and it is estimated that more than 1 out of every 7 people with kidney disease have anemia. You may be watching the TikTok crew kind of lower it down. But out of the 7 people on TikTok and the 8 that's watching, and whoever has kidney disease watching, 1 out of 7 who has kidney disease will have anemia. So most people who have kidney failure, when kidney damage is so advanced that less than 15% of the kidney is working normally, also have anemia. Again, most people who have kidney failure, when kidney damage is so advanced that less than 15% of the kidney is working normally, also have anemia. So who is more likely to have anemia and CKD? Your risk for anemia increases as your kidney disease grows worse or gets worse. People with CKD who also have diabetes. When I say CKD, I mean chronic kidney disease. Okay, not dialysis or dialysis, but from 1 to 5 in dialysis. People with CKD who also have diabetes are at greater risk for anemia, tend to develop anemia early, and often have more severe anemia than people with CKD who don't have diabetes. So look, what's the factor? Diabetes. People older than 60, you may be on here, you may be older than 60 watching me. Hell, I'm 58 in stage 2 kidney disease, but I got it in check. I'm being proactive. You was on my live earlier. You was out doing a nature walk with me. Right before that, I jumped rope. This is nothing to play with, dealing with the 9th leading cause of death in the United States, which is kidney disease. So don't let it come up like a thief in the night and take you down, where now next thing you know, you're at the hospital being diagnosed with kidney failure. So you're like, Steve, okay, we got through the preliminaries, but what are the complications? What are the complications of anemia in someone with chronic kidney disease? Come on, Steve, what are the complications? All right, let's look at it. In people with chronic kidney disease, severe anemia can increase the chances of developing heart problems. All right, and you're like, why? Why is that? Now check it out. Because the heart is getting less oxygen than normal. We're talking about the heart getting less oxygen than normal. And it's working harder to pump enough red blood cells to organs and tissues throughout your body. So people with CKD and anemia may also be at increased risk for complications due to stroke. Remember when I talked about stroke several weeks ago? So don't take this lightly. So what are the symptoms of anemia in someone with chronic kidney disease? Let's get down to the nitty gritty, because you want to know if you having these symptoms, if you got CKD in the early stages. You may be feeling some stuff like, where is this coming from? I ain't never felt this before. And you may be dealing with CKD stage 4, stage 3. Remember, everyone is different. This is not a one-size-fits-all disease, even down to this anemia. It's not a one-size-fits-all. So what I mean by that, you may be in stage 3 and having some of the symptoms that I want to read out, or you may not. You may have stage 4, have some of these symptoms, or you may not. You may be in stage 5 and have the symptoms, and you may not. So let's look at some of these symptoms and see if you're dealing with CKD right now, like stage 3, 4, or 5, and you haven't started dialysis. Let's see if you're experiencing some of these symptoms. So what are the symptoms of anemia in someone with CKD? So anemia related to CKD typically develops slowly and may cause few or no symptoms in early kidney disease, okay? So here are the symptoms of anemia and CKD. May include fatigue or tiredness. You may be starting to feel tired all of a sudden, or fatigue. All right, there we go. Something going on with the internet. That's just the enemy trying to stop the delivery and the dissemination of information. You may have weakness. Okay. You may have body aches. Here we go. You got people with sickle cell dealing with this. Chest pains. Dizziness. You may have some fainting spells. Don't know, like, why am I fainting? Why am I passing out? And you go to the doctors and they do your blood work. Oh, did you know your blood count was low? And some people don't tie the two together. You may be a kidney warrior and be passing out. Don't know why you just started passing out, and it may be your hematocrit, or you may have anemia. Fast or irregular heartbeat. All of a sudden, your heartbeat is fast. Irregular. Headaches. All of a sudden, you're getting these headaches and you don't know where they came from. Sleep problems. Trouble concentrating. If you're watching this and you're a kidney warrior, you may be dealing with some of these problems right now and not know what contributed to these problems. That's why it's so important to come to shows like this where, you know, myself or any other educational broadcasts when it talks about like anemia and other conditions that dialysis patients or people with kidney disease are impacted by. So if you're dealing with these symptoms that I just said, seek care right away. Go investigate what's going on. Be proactive in your health. Be proactive. Seek emergency medical care, one, by dialing 911, especially if you're having chest pain that won't go away. Also, if you had difficulty breathing or shortness of breath, seek immediate care. Don't just stand by and suffer. If you are having difficulty breathing or shortness of breath, and you just been diagnosed with kidney disease, say at stage 4 or 5, even if you're on dialysis, don't take that lightly. Now, what causes anemia and CKD? So they say anemia in people with CKD often has more than one cause. Okay? Now, this is what they're saying, which I already said it before. When your kidneys are damaged, they produce less erythropoietin or EPO. As I said before, a hormone that signals your bone marrow, the spongy tissue inside most of your bones, to make red blood cells. With less erythropoietin, your body makes fewer red blood cells, and less oxygen is delivered to your organs and tissues. In addition to your body making fewer red blood cells, the red blood cells of people with anemia and CKD tend to live in the bloodstream for a shorter time than normal, causing the blood cells to die faster than they can be, replaced. Uh-oh, hold on. Technical difficulties in the studio. Yeah. All right, thank you for that about the Facebook being frozen. Yeah. Okay, we're back. But as I was saying, people with anemia and CKD may have low levels of nutrients such as iron, vitamin B12, and folate that are needed. You need this to make healthy red blood cells. And then that's where this comes into play, iron. Okay? And y'all see it, we give it in the clinic, come in these bottles. You can see some of these still have residual iron in it. They come 5 in the packet or 5 in the tray, 2 trays, so it's 10 in the box. This is for illicit. And this is what we give a lot of patients every week, or we give them a course of iron each treatment. And you may have had it say, oh, it tastes like licorice, or it tastes like that. So other causes of anemia related to CKD include blood loss, particularly if you are treated with dialysis for kidney failure. That's what I was saying. If you're on dialysis and your blood clots the machine, or you lose a lot of blood because of operator error, or your access starts to bleed out, you need to check your hemoglobin and hematocrit to see if your blood count has got even lower with that blood loss. Because if you're not reproducing red blood cells because you have CKD, you're not secreting that hormone, how are you going to how is going to get replaced? Next thing you know, they're talking about giving you a blood transfusion. So another way other causes anemia is infection, inflammation, which lupus warriors have inflammation, and that can cause anemia. And then malnutrition. That's why they say, hey, get your protein level up. Get your protein level up. Malnutrition is a condition that occurs when the body doesn't get enough nutrients. This is not rocket science, guys. Now, how do healthcare professionals diagnose anemia? One, they look at your medical history. That's right. That's why they got your medical charts at the hospital, and they do laboratory tests. They can make comparisons. So your healthcare professional will record your medical history, right? When you go to the PCC and they writing down stuff. And they may ask you about your symptoms. What kind of symptoms you having? Current and past medical conditions. Prescription and over-the-counter medicines you take. And of course, like always, your family history. Can't do a medical history without your family history. Then they're going to do a physical exam. Okay? During the physical exam, your doctor may check your blood pressure, check your heart rate, and examine your body, including checking for changes in skin color, rashes, or bruising. Okay? Now, for the blood test, this is how they check for signs of anemia. Healthcare professionals use blood tests to check for signs of anemia or other health problems. All you do is take a sample of blood from you and send it to the lab. You waiting for the results. So a blood count test, CBC, complete blood count, can check many parts and features of your blood, including the number of red blood cells, the average size of red blood cells, the amount of hemoglobin in your blood and in your red blood cells, and the number of developing red blood cells called reticulocytes in your blood. Some of these blood count tests and others may be combined, as I said before, in a test called a complete blood count, or CBC. Come in, let me see. May come in a purple, lavender, similar to this. You may be on dialysis and they come around, they had the lab tubes laying on the side of the chair. And you're like, damn, I just saw some lab work last week. And you're asking, what is this for? Why are they drawing blood again? They may be drawing the CBC. And it comes in this, complete blood count. So if you're sitting at the tray and you see this tube on your table with your name on it, they drawing a complete blood count, CBC. They checking your hemoglobin and your hematocrit. Okay. Now, also the healthcare professional may also use blood tests to check the amount of iron in your blood and stored in your body. These tests may measure ferritin, the protein that stores iron in your body cells, and transferrin, a protein in your blood that carries iron. Okay. Now, healthcare professionals also sometimes use blood tests to check for low levels of folate and B12. You hear some people, oh, I gotta go get my B12 shot. I'm gonna go get my B12 shot. Okay. So now look, check this out. If test results suggest you have anemia, but the cause is unknown, the healthcare professional, your doctor, may perform additional tests to look for the cause or may refer you to a hematologist. Okay? Now, a hematologist is a healthcare professional that treats blood disorders. Now, let's get to another meat and potatoes. How do healthcare professionals or doctors treat anemia and chronic kidney disease? How are they doing it? And I showed you guys earlier. Healthcare professionals first treat any underlying conditions that may be causing the anemia, such as an iron or vitamin deficiency. If your anemia is mild and you have few symptoms, you may not need treatment at first. Okay? Treatment for anemia may ease your symptoms and improve your quality of life. Now, if you're dealing with CKD, you just got it, and you're dealing with some of the symptoms that I read, and you could be on TikTok watching the other creators. Next thing you know, you're experiencing some symptoms. Chest pains, body aches, dizziness. And you want to know, like, what the hell is going on? You watching content creators, not knowing what's going on with you. And that's what I said. Once you leave those pages, you're still going to have the symptoms. And that's what broadcasts like these are here for. So if I do something and you just got diagnosed and you don't know anything about anemia and you having some of these symptoms and you got chronic kidney disease stage 4 or 5, but you're not on dialysis and no one told you about anemia, then hopefully this information can help you, right? Can help you so you can improve your quality of life. Isn't that the end result of improving the quality of your life in spite of the condition that you may have? So the doctor may also refer you to a hematologist or a nephrologist, which is a kidney doctor. And a kidney doctor, again, nephrologist is a professional that treats people with kidney problems. So just because you go see a nephrologist doesn't mean you're going to be on dialysis. But you want to know if you got kidney disease so you can treat it as soon as possible. So let's talk about iron. There's another medicine I just talked about that helps treat anemia in patients with CKD. If you don't have enough iron in your body, here go the iron, your healthcare professional may prescribe iron supplements either as a pill or intravenous infusion. Intravenous infusion. If you're on dialysis, you may be given IV iron supplement during your dialysis treatment. Okay, iron supplement helps your body makes healthy red blood cells. So if you don't have enough iron, then you're not going to make healthy red blood cells. Vitamins. The doctor may ask you to take vitamin supplements as like vitamin B12 or folate, both needed to make healthy blood cells. If your body doesn't have enough of these vitamins, it's not going to make any healthy blood red cells. And then, of course, now the medicine. The doctor may prescribe an erythropoiesis ESA stimulating agent to treat your anemia. ESA send a signal to your bone marrow to make more red blood cells. This is synthetic. You see us putting it in the lines when you're on the machine. Hey, I'm about to give you your Aranesp or your Mircera, and you sitting down on dialysis watching TV or something. The nurse comes and lets you know and wipe the thing off with alcohol and stick the needle in. They come at you with the needle. You think they're about to stick you. You're like, whoa. No, we're going to put it in the line. And they normally put it in this line right here in the venous, this port. If you're on dialysis, we inject this in this port right here. Wipe it with alcohol, and then we inject it, pull it out, pour the thing up, and discard it in the needle basket or the needle sharps container. So if you're on dialysis, you may receive IV or subcutaneous under the skin. You may go to the doctors and they give you this shot in your belly. All right. During your dialysis treatment. If you are on peritoneal dialysis or do not receive dialysis, the doctor may give you that as shots, like I just said, and may teach you how to give yourself these shots at home. You may got a box of these at home watching this and give yourself shots in your belly like diabetics give themselves insulin. Okay? Also, the doctor may prescribe iron supplements to help erythropoietin work better or to reduce the amount of erythropoietin you need. Because this is expensive. Make no mistakes. This is expensive. So they're going to try to treat you every way else to get those red blood cells up before they start giving you this. Excuse me. Woo, excuse me. Now, erythropoietin may ease your symptoms and help you avoid blood transfusion, but the treatment is not right for everyone with CKD and anemia. Not everyone can tolerate this, especially if you got extremely high blood pressure. Because with anything, there are risks and benefits. Even in hemodialysis, there are risks and benefits. Any medicine you get, risk and benefits. You go get a transplant, risk and benefits. It's risk and benefits to everything. And like if you want here and you decide on whether you want to get a transplant or not, you got to look at risk, the benefits, and the reward. Reward versus the risk. You got to look at both sides of what can happen with a transplant and what can't happen. So talk with your doctor about the risks and benefits of using this. The erythropoietin therapy, Airnest, Macera, Epogen. What are the risks? Hell, just like the COVID shot, there are risks and benefits. And lastly, but not least, blood transfusions. And we all heard of blood transfusions. In some cases, doctors may use blood transfusions to treat severe anemia and CKD, chronic kidney disease. Hell, I was working at a dialysis clinic and they called from the lab from the hospital. Patient's hemoglobin is 6 point such and such. Now doctors got to treat the patient, send the patient to the hospital to get a transfusion. So a transfusion can quickly increase the number of red blood cells in your body and temporarily relieve the symptoms of anemia. However, doctors may limit or avoid blood transfusions because they can sometimes lead to other health problems. The body may develop antibodies over time that damage or destroy the donor's blood cells and may delay or reduce the possibility of future kidney transplant. That's what I said in the beginning. Let me read that again. The body may develop antibodies over time that damage or destroy the donor blood cells and may delay or reduce the possibility of a future kidney transplant. Iron from transfused red blood cells can build up in the body and damage organs, called iron overload or hemochromatosis. All right, as we wind it down, can you prevent anemia and chronic kidney disease? You may be asking. You may not be able to prevent anemia But managing your kidney disease may help delay anemia or prevent anemia from getting worse. Let me repeat that. You may not be able to prevent anemia, but managing your kidney disease may help delay anemia or prevent anemia from getting worse. Okay. Now let's look at how does eating, diet, and nutrition affect anemia and CKD. You may need to change what you eat. We hear a lot about nutrition and diet, and that is so true. You may need to change what you eat to manage your anemia and CKD. So you got to work with your dietitian, your doctor, to develop a meal plan that includes foods that you enjoy eating, and while also maintaining kidney health and managing your anemia. So if your body, for instance, if your body doesn't have enough iron, right, vitamin B12 or folate, your healthcare professional or dietitian may suggest that you add more foods with these nutrients to your diet. However, some of these foods have high amounts of protein, sodium, and phosphorus, okay, which people with CKD may need to limit. So you got to be careful about that. So look, talk to your dietitian or your doctor if you have any questions about anemia and CKD, because it's a serious condition, okay? And if you don't keep up with it, you find yourself having to get blood transfusion, and then when you get on the transplant list, let me say, wait a minute, we can't transplant you because you got too many antibodies. And then you regret getting that, getting that transfusion. So let me read some of these comments. Hey, Dericia, thank you. Made it from TikTok. This way I'll be able to catch up on your oh, thank you, Dericia Stevenson. I really appreciate that. Thank you so much. She made it from TikTok, man. That's what's up. That's what's up. Hey, Tom, how you doing? Appreciate you. Hope everything's going well with you and your wife. All the best to you as well, Tom. Thank you. P Teach, thank you. Good evening to you as well. I'm glad you joined. Again, we're talking about anemia and chronic kidney disease. I hope you got something out of it. Because a lot of times people who start dialysis, it's a lot of this stuff can be overwhelming. Information overload. I get it. So that's why I don't come on here every night like trying to stuff it down your throat. But at the same time, the information is so important and time critical in some cases. Because you probably, I don't want some people to miss this information that could be dealing with this problem and not know that they're dealing with the problem. Camille, thank you for joining. I appreciate you. Camille Pantuso, thank you. God bless you. I appreciate you. PT says, yes, I had this. Better now. I am being monitored, taking my iron pills daily. Oh, that's awesome, PT. Also, remember with the iron pills, some people have reported, and I do know iron pills can cause constipation. Iron pills or ferrous sulfate can cause constipation. And if you find yourself dealing with constipation, that you're taking iron pills, like if you're on dialysis, they tell you to stop because they could give you iron, we can give you the iron IV. And so it's no use of taking that. Again, iron overload. If you're taking the iron pills at home and we giving it to you at the clinic IV, could also turn into iron overload. But the iron at home, the pills, has been known to cause constipation. If you deal with that, you can get some Miralax. That's been known to help people who experience constipation. Is Miralax. Comes in a purple bottle. PTs. Yeah, it's very expensive. Yeah, the Epogen and the iron. I'm sure they charge an arm and a leg. I never seen anyone's bill for that, but I'm sure. Let's go down. Stephen Graham, thank you. I appreciate it. I appreciate you joining. Absolutely. Okay. Oh, PT. She said, Steve, what is your suggestion for dietitian type? Well, I'm going to have a dietitian on next Tuesday, January 31st at 7 p.m. named Kelsey Reed. She is CKD, nutritionist and dietitian, and she thinks outside the box, P-Teach. Like, she's not one that works for like these major corporations and give you like the handouts and, you know, think you got this draconian meal plan. No, she gives you great suggestions. There's a lot of dietitians, CKD dietitians on Instagram and TikTok. I would definitely reach out and look at some of their content. Again, they think outside the box so you can have a great experience with your meals and still be in compliance. Okay? So, with that being said, I'm about to end this live and go on TikTok. Come to the after party on TikTok, about 5, 10, 15-minute after party, after show party, something I normally don't do. But if you're on TikTok, come to Steve, the Kidney Nurse. We on live. Gonna have a little music, 80s, be kicking it and going from there. So thank you guys for watching on YouTube and Facebook. I appreciate you. Again, if you want to come to the after party, it's going to be on TikTok Live, Steve the Kidney Nurse. All right, guys, stay blessed and encouraged. Have a great night. If you go to treatment tomorrow, have a safe treatment. And always question what's going on, no matter what. Peace and blessings. I'm out. Stay blessed and encouraged, guys. Peace.
Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on the beat, put on the map, put on my team. Take out every motherfucker in between, know what I mean? Better myself, better my aim, better my rap, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would, and now I'm running.